Hi folks, the BikeFit Physio back here with another video with A1 Coaching about common cycling injuries. So today we're going to go on about the front of the knee. Last week you'd have seen the back of the knee and the week before the side, so we're covering it in detail. Today I want to just get across that there are many structures that can cause pain in the front of your knee, right? And it's not actually that important to find out or identify which structure is causing it. It's more important to know how to diagnose that you have frontal knee pain and then how to manage it. So there is a good few causes to it, and we're going to go through the most common, starting with just basically reduce strength in your quads. So if your quads aren't able to produce enough torque, you can then cause more forces to go through the front of your knee and then give you pain. Number two is like a weakness in the kinetic chain, and that basically means the muscles all working together as a family down the leg. If there's a weakness in that chain, then it can give rise to pain in the knee. Number three, just simply having your saddle too low or too far forward. The reason for this is it'll cause increased kind of compressive forces on the knee. So that's because the knee is just bent too much because of the saddle height, and that will give rise to pain also. Number four, we talked about it last week, a sudden increase in your training. So, again, the structures in the knee are not used to this sudden increase, and it can just be enough to tip them over and give you pain. And number five, there's some research going into it at the moment about how if we're pushing through the outside of our foot in the pedal stroke, we can cause a kind of a loading to go up through the leg and give rise to pain in the knee. So we'll look at that also. So now if we just go ahead and talk about each of the sources for the front pain in the front of your knee. We talked about the strength, just simply being not strong enough in your thigh or in the kinetic chain down the leg. So, I mentioned it in other videos, the importance of being able to do a nice single leg dip with good alignment. So, you want to be able to dip down and then keep the knee in line with the middle toe, in line with the hip, and then come back up. What we don't want to see is this sort of a hip drifting out and knee drifting in, and that's the reason why you can develop knee pain on the bike in the first place. Number three, we mentioned about the saddle being too low. Just again, have a quick look at your bike. If you sit on your saddle and you put your heel on the pedal, and then you pedal to the bottom of the stroke, your knee should just be about straight, a little bit less than straight, and that's how you know that your saddle is roughly in the right place. It's not an exact best efficient position, but it's a safe one. Number four, look at the training load. Are you gradually increasing your training, or are you just stop-start? Are you going from 0 to hero? That will be enough to cause pain. And number five, let's go and look at that. We'll bring in Jim. The study basically is looking at like the how we do our heel raises. So if we ask Jim to turn around and we pick a leg, right leg, and then we get you to hook your left leg around the back of your right leg, yeah, and then you go up into a heel raise, right? So you just watch the client go into the heel raise and look at where they're leaning through their foot. So, and come on down and just repeat. So maybe look at 12 heel raises. And if you do this at home, just do a couple of heel raises and then look down and see where are you weight bearing. So Jim's already said that he tends to weight bear on the outside of his foot, right? So you'll pick this up on the heel raise. And what that's doing is it's developing more the outside head of his calf muscle and also leaving the inside weaker. And then what will happen then is when he's on the bike, he's going to be leaning down through the outside. So this can actually be a source of knee pain. So to change that, we just make Jim aware of it, get him to do his heel raises, get him to lift up, and then lean a little bit more towards the inside. So maybe 60% or 70% on the inside, 30% middle. Just try to keep away from being on the outside of your foot. So up again. And then he won't be long developing and strengthening up his medial gastroc. And then just change the way he's pedaling as well. If you can, just emphasize the inside of the foot. Yeah, so like, you might be thinking each of these reasons for the front knee pain might be smaller, insignificant inefficiencies. But when you think about it, if you were out on the bike for 5 hours, pedaling at a kind of a average of 90, which is quite typical, 90 revolutions per minute, that actually amounts to 27,000 pedal strokes on each leg. So the accumulation of that with the inefficiency will give you the knee pain. Till next time.